The stroke alert icon is used to initiate a stroke alert activation to the receiving stroke center. See your local protocols for circumstances that require EMS to initiate a stroke alert activation to the receiving stroke center. Here's how it works. First, click the icon. Then, fill out the form. You'll notice that the form requires you to input all areas highlighted in red and are all self-explanatory. Select your EMS unit number, which is customized to your EMS agency. Then input the patient age and gender, and then your ETA. Then indicate if the patient is conscious by selecting yes or no. Although not a mandatory field, EMS can quickly add their Cincinnati stroke skill findings here. There's also a place to include the FAST-ED score. FAST-ED is a stroke severity scale used by many EMS systems throughout the nation, including many agencies in Michigan. FAST-ED is used by EMS to identify and measure the severity of stroke symptoms. The final required field requests EMS to input the patient's glucose reading. Although not mandatory, EMS can include additional free text notes here. It may be beneficial to provide a brief description or additional info. Whatever you input, keep it simple. Once you've completed the form, hit Attach in the upper right corner. You'll then be prompted to select the destination hospital that you're requesting transport. Select the destination and hit Next. Prior to sending, review the summary. Although not required, you can add text to the body of the notification. The eBridge application also allows EMS to send audio, video, or pictures along with the notification to help the hospital understand the circumstances of the scene so that they can best serve the EMS crew and the patient. In the case of a stroke patient, consider taking a video of your stroke assessment and sending it to the stroke center along with your notification form. This is a very powerful piece of data that can be shared with the hospital and even the stroke team so that they can mobilize as fast as possible. Remember, time is brain. The faster EMS can deliver vital information to the stroke center, the faster the stroke team can make treatment decisions and restore blood flow. When you're ready, hit send and wait for the hospital to call back via the eBridge application. The hospital will receive and review the notification form and any notes or attachments. Then the hospital will contact the EMS crew via the eBridge application and take report from EMS. Once communication is established, give your stroke report to the hospital per your local protocols and keep it clear and concise.